what happens if the patient avoids root canal treatment? We come across patients who come to us for consultation. They are in pain. We check their teeth. We take x-rays or a CBCT scan, and then we tell the patient this tooth will have to go for a root canal treatment. For various reasons, either the patient has fear of the treatment or due to the cost, a patient may not turn up for a root canal treatment. Sometimes patients don't turn up for the treatment anywhere. In root canal treatment, when a patient comes to us with a complaint of pain, and if there is a big cavity in the tooth, and we have confirmed that that tooth is creating all this trouble, then we have to go for a root canal treatment. If this is not done, temporarily patient's pain may subside because he may use antibiotic, or after a few days sometimes the infection will slow down and he has relief of pain. Now again, after a month or so, the patient starts having pain. What exactly happens to this tooth? Inside the tooth there is a cavity. This cavity is found by the bacteria which are actually attacking the top of the tooth. There is the enamel. Then it goes into the dentine. It means that part of the tooth has become very soft. So the enamel is dissolved, the dentine is again, part of it is removed, and then it becomes very soft. So if you leave it like this, the cavity which was very small initially slowly becomes bigger and deeper and wider. Now once the cavity becomes very wide, then this tooth will break while chewing. That is one of the things. Once the tooth breaks, there are many chances this tooth cannot be saved and this tooth will have to be removed. Second thing is, the patient could get pain, could get swelling, and this infection, what is inside the tooth, goes into the roots and beyond the roots, and then that can irritate the bone there. The roots are actually inside the bone. So the bone will get irritated and you will start seeing bone destruction. So this can also lead to cellulitis or space infection. Space infection is a collection of pus around the tooth, so which we can see it in the jaw as a swelling, and sometimes the pus can extend up to the neck area, and this can be a medical emergency where the patient has to be admitted to the medical hospital and he has to be treated for that. So this is the second thing. The third thing is, when there is bone destruction, the tooth will start becoming mobile or it starts moving. So if this tooth moves a lot, it cannot be saved. A single visit treatment could become a multi-visit. There's a less chance of success. So once you plan for a root canal treatment, do not delay. Get the root canal treatment fast, get the post-endodontic filling done, and then go for a crown as quickly as possible, and then you should chew on that side. One more thing, suppose if there is a cavity formation and there is pain on that side, patient tends to avoid chewing on that side. So when patient tends to avoid chewing on that side, naturally there is going to be other side chewing, which will cause more wear of teeth on the other side, and this is going to have an effect on your jaw, on your muscles of the jaw. You can have ear pain, you can have pain in this area. It can lead to other problems like TMD. So it's always better to get the problem solved as soon as possible and start chewing on the tooth normally. This is what we would suggest.